We're so delighted to welcome Dr. Martha Turner.
Hi, everybody. My name is Martha Turner.
Dr. Martha, could you please briefly introduce yourself?
Sure. Hi, I'm retired from the Air Force after 30 years. And recently, I was teaching at the University of Minnesota and consulting for the American Nurses Association in their Center for Ethics and Human Rights. It's indeed a spectacular effort from this planning committee and team and the AV Tech Wizards. So thanks a lot for including me. I'd like to tell you a little about my interests. I have so many, but currently my focus is nursing practice around the globe and nursing ethics, with particular emphasis in pain management and end-of-life care. I've also explored the ethical issues found in practice, research, education, and administration. From a very young age, I was inspired by Nightingale. So today, I'd like to talk about her life and her work. This is what made me interested in Florence Nightingale. All last year, in 2020, we should have had a celebration of nursing. Nightingale's birthday was 200 years ago, and the World Health Organization declared 2020 as the year of the nurse and midwife. All over the world, celebrations had to be canceled or adapted. So today, let's adapt and celebrate by looking at her life, her work, and what inspires us today. Her story starts in May of 1820. As we listen to her story, we will see our heritage unfolding. Her path as a practitioner, leader, and advocate for health was not linear, but rather had many overlapping trails. Clinical work, research, administration, and education were all folded into one, as they should be for us. We don't get to do one at a time, but rather all four every day. I mentioned that I've been interested in ethics and see it in my life and work every day. So I wanted to look at Nightingale's life and work through an ethics lens. There's so many lenses to choose from, but a recent favorite is Slow Ethics and the Art of Care by Anne Gallagher. She recently published this useful approach with several easy to understand elements. Those elements are seen on the slide: stories, sensitivity, solidarity, space, scholarship, and sustainability. The first is stories. They animate human life. In nursing, we need both stories and theories. Anne cites the work of Arthur Frank, who explains that stories do many things. They deal with human troubles. They expose human character. They use different perspectives or points of view. They illustrate choices and consequences, and they present multiple truths. And lastly, they imagine possibilities, how things might have, could have, or should have been different. Next is sensitivity. Harmony and dignity are the underlying values for sensitivity. It reminds us to be aware of and interpret verbal and nonverbal cues, and to be aware how our behavior influences others. Solidarity is third. This is a value that reminds us of our common humanity. It is supported by the virtues of fairness, honesty, and trust. It describes social cohesion and connection and seeks social justice. Solidarity is important in patient care, leadership, and advocacy. The fourth is space, and there are three kinds of space: physical, relational, and moral. Physical space is, of course, our caregiving space. Relational space is a place of engagement. It is everything from our personal space that encompasses to that space that encompasses the world. Last is moral reflective space, where we create the quiet. We take delight in our achievements, and then we conceive the next challenge. The fifth is scholarship. This is the knowledge that comes from study. In scholarship, we take a long, deep view and explore previous studies and avoid the inclination to find a quick fix. Scholarship informs our stories. Last is sustainability. This is a core element of slow ethics. It prevents deterioration of what we have and encourages us to seek balance and to become comfortable with ambiguity and complexity. It asks us to listen carefully and judge slowly, and to attend to our relationships, especially our relationship with technology. In all things, we must seek balance. Without it, we exhaust our resources. Now, with these elements in mind, let's listen to Nightingale's story. With stories, we just listen quietly. This is a painting of Florence with her sister. She came from a privileged home. Nightingale followed her calling, and against the wishes of her parents, she pursued nursing. She located and attended the best nursing school of the time in Germany, and then immediately led others down the same path. Her life work started with clinical practice, working in the Crimea. She made provisions for soldiers' health, not only for their illnesses, and she always responded to their suffering. Her work also included research. She developed evidence and used statistics in writing her reports. As an administrator, Nightingale demonstrated resilience in the face of obstruction again and again. Here is one example. The British officers were most insistent that she return home, so they tried to limit her provisions and usurp her authority in the hospital. But she found many workarounds to get what she needed. That's another skill of nurses today. Finally, there was her work in policy. Many of the improvements she envisioned were not achieved until after World War II. We see sensitivity in Nightingale's life in simple ways. She wrote letters to the soldiers' families, and frequently she sent money for household needs or funeral expenses. Often she bought personal goods for patients or initiated recreational activities. For nursing students, she provided housing, uniforms, and subsidies. Perhaps solidarity should have been discussed first. Today, her activities would be called social justice. Nightingale's focus was to care for the marginalized. Concern for society's disadvantaged directed her efforts. She believed the poor should have the same care as the rich, and she thought elitism was unethical. Often she functioned in all sorts of roles: cook, housekeeper, scavenger, or washerwoman. She frequently raided the store for supplies. Today, nurses in many places function in these roles, as there's a huge variation in nursing practice across the globe. Nightingale had a non-judgmental, non-moralistic view of the poor, which was radical at that time. We'll consider space next. Nightingale was very aware of and used relational space. In this photo, we see nurses poised, ready to engage in conversation. There is not a single cell phone in sight. According to Fowler, early nursing ethics is relationally based and virtue-oriented. Writings and teachings centered around these relationships: nurse to patient, nurse to self, nurse to nurse, nurse to physician, and finally, nurse to society. In her early years, Nightingale flourished in new and unfamiliar spaces. However, she also suffered from depression and isolated herself for long periods of time. Here she is in her room towards the end of her life. She used reflection by reflecting on concepts and theories, by reflecting on people and relationships, and finally, by reflecting on herself. It's interesting to note that she lived from 1820 to 1910. So she was born 200 years ago, but died just over 100 years ago. To me, that makes her seem not so distant and a little more immediate. In Nightingale's story, we see leadership in many settings. Nightingale elevated the public perception of women who nursed. For her, educating nurses was as much for the transformation and opportunity for women as it was to provide better care for the patients. Here we see a photograph of Nightingale with a group of her students or probationers. She created balance for the nurses she supervised by setting their schedules so they worked 8-hour shifts, 6 hours of clinical and 2 hours of study. Another example of balance was in the curriculum for nursing education. In the courses, there were equal parts nursing preparation and moral formation. Ethics was begun at the outset of the program and infused throughout the entire curriculum. This is an effort we continue today in our nursing programs. Some other huge contributions were establishing rural health nursing, then known as district nursing, reforming workhouse or prison regulations to focus on the health and well-being of the inmates by preventing illness, and by instituting cleanliness, sanitation, and better nutrition, just as she had done for the soldiers. Nightingale was a passionate statistician, a pioneer in developing survey instruments and the graphical presentation of data. She sent questionnaires to hospital administrators, collected and analyzed the results, wrote the reports, and established commissions to get the needed changes made. Here's an example. The coxcomb, seen here, was a circular design divided into 12 sectors, each one representing a month that laid out the relationship between improved sanitation and a plummeting death rate. She was committed to getting the science right and to making it understandable to politicians and public servants who made the important decisions. In nursing, public health, and hospital design, her work was evidence-based or evidence-informed, even though those were not terms used in her time. One of my favorite quotes is, "Nightingale thought using statistics to understand how the world works was to understand the mind of God." Her most sustainable work is Notes on Nursing, and it is probably her best known scholarly work. It is not so much how to be a nurse, but rather how to take care of others. It clearly addresses prevention rather than cure. It was first published in 1860 and sold 15,000 copies in 2 months. It is still available in several places online. Following Nightingale is my inspiration, I said yes to the opportunity to serve as content editor, revision coordinator, and co-lead writer for the American Nurses Association Code of Ethics a few years ago. Now I'm working with a team of nurses around the world, revising the International Council of Nursing Code of Ethics. Unfortunately, our work is on hold while COVID problems are addressed. Some closing thoughts. As nurses, we care. We care together. We question. We listen. We pause. We breathe. We reflect. We smile. And we say yes to opportunities. And we continue on our paths with strength, humility, and of course, humor. Thank you.